Hi, my name is Vanessa Stitzline and I'm a third year at Ohio State majoring in health sciences. Today I'm going to be giving a presentation on healthcare in Austria versus healthcare in the United States. I chose Austria because Austria is a country I visited and I thought that it would be something I would be interested in learning more about. So we're first going to learn more about the types of healthcare system in Austria and the United States and how they differ. So Austria has a social health insurance system that is paid into by employees. This also, if an employee gets sick, this insurance allows them to still receive full pay. It's called a sickness benefit. Through this insurance, the employer covers both the employee and the employee's family. So this would include a housewife, a house husband, all of the children, and that is called co-insurance for the employer's family, employee's family. And then in the United States, we have a hybrid system. So we have federal level, which is Medicare. We have at the state level Medicaid, and then we have private insurance, which is the most common form of insurance in the United States. And then we have the Affordable Care Act, which is relatively new and is still being improved and implemented as a universal healthcare system. Next, we have population health. I spent time examining the life expectancy in both developed nations. I found that they were relatively similar, differing by 80 years and then 79 years in the United States. I did find it interesting that females in both countries lived almost 5 years longer. And I think that this is due to infant mortality rates in both countries. For men in Austria, the infant mortality rate is 4.75 and it's 6.12 in the US. And then females is much lower in Austria at 3.18 and 4.88 in the United States. I think this is something that both governments could look at so that they could lower the infant mortality rate and thereby increase the life expectancy range for the male and then overall as well. Next, we have healthcare spending. I examined the out-of-pocket per capita cost. In Austria, it was $1,400 per capita spent in 2017, and then in the United States, $1,100 per capita spent in 2017. This graph lays it out nicely in comparison to other countries. Along this axis, we have the name of countries and then how much is being spent per capita. We have the United States and Austria falling here at the end, and only to be followed by Switzerland. So I think that both countries should take this into consideration where they are falling against other countries and work to lower that with new healthcare policies. Next, we looked at the healthcare system, specifically breastfeeding programs in hospitals. Both countries have adopted this baby-friendly hospital initiative, and it has been a large success in the United States with 54% of hospitals participating in this program. And then only 16% have participated in the program in Austria, but it's continuing to expand. This program is great because it gives mothers the skills and information they need to be proficient in breastfeeding and taking care of their child. Sometimes this program does decide if the mother will breastfeed once leaving the hospital, and that's because they have the 10 steps to successful breastfeeding. And then if the mother can't breastfeed or needs another option, they have the International Code of Marketing of Breast Milk Substitute so that the baby is still getting what they need and they're still giving the mother other options, not just, oh, you have to breastfeed. No, they're giving them other resources and information to utilize as well. So next we have injury prevention for children. In Austria, we have the Austrian Committee for Injury Prevention in Childhood. So this committee has the goal of reducing childhood injuries, especially those that lead to severe injuries, including disability and even death. So they decided that those areas would include bicycle injury, passenger safety, safety at home, and playground injuries. That's where children are experiencing the most injury that lead to death or disability. So they created the helmet campaign, which would be for the bicycle injuries, and that increased helmet use from 8% to 36% in just 3 years, which is remarkable, and they're still implementing that campaign today. And then we have the home safety program, which includes a kit, and that kit includes includes items to treat household injuries, such as poisoning or burns and scalds, and so that's just another resource that families can use in order to prevent household injuries. And then in the United States, we have Healthy People 2020, which has created an injury and violence prevention initiative. And this is important because unintentional or intentional injury is considered to be one of the top 15 killers in the United States. So this is something that we decided we really needed to focus on. So the current interventions that we have, just a few of them, are that we have screening for abuse of vulnerable populations. We also have a motorcycle helmet campaign, which I'm sure you've seen, and then the education on substance abuse. So that's a really big thing for Healthy People 2020. But they've also noticed that we have a lot of emerging issues such as traumatic brain injury, distracted drivers now that everyone's using phones and technology in the car, as well as prescription drug overdose with opioid painkillers. So both countries have included an injury prevention program and are considering it to be very important in their country. Next, we have a physical environment, and that would be safe drinking water. Both countries have considerably good drinking water. In Austria, a lot of the drinking water comes straight from the Alps, and they have regulations from the Austrian Food Safety and Consumer Protection Acts, as well as the Austrian Drinking Water Ordinance. In the United States, it's a little bit different. We have the EPA, which enforces our regulations and standards, also called the Environmental Protection Agency. So drinking water used to be a state or local level issue, but in 1974 it was considered to be a federal issue. And then since then, 90% of the community waterways are in compliance with the EPA's regulations. So that's a lot of our drinking water is being heavily regulated. But the 10% that is not up to standard is in rural small areas that the EPA just can't get access to and get resources to. So now we're going to talk about the access to care. This is going to include the uninsured adults from 18 to 64 in Austria and the United States. Austria is amazing. It has less than 1% of people being uninsured, and this is due to the social health insurance. Those that are uninsured, it's because of the unemployment benefits. If they're unable to receive those, then they're going to remain uninsured. It's also could be due to losing co-insurance. So if you get a divorce or your spouse dies, then you're going to lose your insurance as well. In the United States, we have an insurance rate of 12.8%, which is very high. And I think that this is because the Affordable Care Act excludes undocumented immigrants from this. And 19 of the 50 states have not expanded their Medicaid qualifications. And people don't understand the new health insurance marketplace that was created by the Affordable Care Act, as well as they can't afford health insurance or they're not sure what plan is best for them. So next we're going to talk about the social and economic environment. And in both countries, I looked at the unemployment rate. I found that they were relatively similar at 4.8% and 3.8%. But in Austria, men were more likely to be uninsured, but not by very much of a margin at all. In the United States, men and women were equally likely to be unemployed. This could be due to the economic conditions at the time. This could also be due to trends in the aging population, the level of education you have. So if you're not qualified for a job, you're not going to get that job and you will still be unemployed, as well as technology replacing workers. So more and more we're seeing new technology advancements being made and less jobs being available in the marketplace. So in summary, both countries are very similar in their life expectancy, their unemployment rates, quality of drinking water, and their intervention program or injury and prevention programs that were created. However, they differ in their rate of uninsured people, as we saw, and their out-of-pocket cost. So key takeaways: the social insurance program leads to more insured persons. However, both developed countries can still have flaws in both areas of healthcare. So in the United States, our insurance program is definitely lacking, and in both countries, the out-of-pocket costs are lacking. So I think that we need to create future U.S. policy on continuing to create a universal healthcare system, as well as in Austria and the United States, lowering those out-of-pocket costs so that people can get better access to care. These are the resources used throughout the presentation, and thank you so much for watching.